Welcome to section 2 of cardiac pathology. In this section, we'll be discussing hypertension. Let's get started. Simply put, hypertension is elevated blood pressure. The definition frequently changes, but the most recent guidelines state that hypertension can be diagnosed when the blood pressure is greater than 130/80. So if a patient has either a systolic blood pressure greater than 130 or a diastolic blood pressure greater than 80, they have hypertension. The patient does not have to have both elevated systolic and diastolic. Blood pressure is determined by cardiac output and systemic vascular resistance. This is based on the equation blood pressure equals cardiac output times systemic vascular resistance. We talked about this in more detail in our physiology section. Many factors influence blood pressure, but there are three major ones that you should be familiar with for step one. These include the sympathetic nervous system, plasma volume, and the renin-angiotensin-aldosterone system. All right, with this basic understanding, let's discuss the various types of hypertension. The first type we'll discuss is primary or essential hypertension. The exact pathogenesis is not very well understood, but it's likely due to environmental and genetic changes that affect cardiovascular and renal function. This is responsible for 90% of cases, so it's by far the most common cause of hypertension. Risk factors include age, obesity, family history, race. African Americans are at greatest risk, a high sodium diet, and inactivity. In secondary hypertension, an underlying medical condition is responsible for the elevated blood pressure. Examples include renal artery stenosis, fibromuscular dysplasia, pheochromocytoma, Cushing's syndrome, and obstructive sleep apnea. The pathophysiology varies, so these can be best understood when discussing the particular disease. For example, in a patient with stenosis of the renal artery, the blood flow to the kidney is obstructed. So if this is the renal artery and this is the kidney, stenosis of the artery would result in decreased blood flow. This would activate the renin-angiotensin-aldosterone system. Aldosterone would reabsorb water and salt, and this would in turn elevate the blood pressure. A very similar mechanism would occur in a patient with fibromuscular dysplasia. So again, there are many examples, and the pathophysiology is quite variable, and we'll learn about this in more detail with each disease. All right, finally, unlike primary hypertension, secondary hypertension is quite uncommon and accounts for less than 10% of cases. Another cause of hypertension is white coat hypertension. This is blood pressure that's elevated during office visits, but is normal in other settings. So when these patients are out of the office, blood pressure readings are normal. This is why the diagnosis of hypertension is typically not made unless the blood pressure is at some point measured outside of an office setting. Hypertension can also be classified as hypertensive urgency or hypertensive emergency. Hypertensive urgency is severe hypertension classified as greater than 180 systolic or 120 diastolic without evidence of acute end organ damage. End organ damage can refer to many conditions such as retinopathy, left ventricular hypertrophy, ischemic cardiovascular disease, stroke, or kidney disease, just to name a few. On the other hand, hypertensive emergency is severe hypertension with evidence of acute end organ damage. I like to keep these two definitions straight in my mind by thinking about the words urgency and emergency. If something is urgent, it needs to be dealt with pretty quickly, right? Maybe in the next few minutes or hours. However, if something is an emergency, then it needs to be dealt with immediately. For example, if you're having a heart attack or you just got in a car accident and are losing liters of blood per minute, these are emergencies. They need to be taken care of immediately. Similarly, hypertensive emergency needs to be dealt with immediately. These patients are literally dying before your eyes because of the high blood pressure, so this needs to be controlled immediately. On the other hand, hypertensive urgency is definitely a problem and needs to be addressed quickly, but not like hypertensive emergency. The final point you should keep in mind is that hypertensive urgency and emergency are helpful terms, but don't really get at the heart of what's causing the hypertension. For example, a patient with hypertensive urgency could have primary, secondary, or even white coat hypertension. We don't necessarily know what's going on. We just know that the patient has high blood pressure. All right, now that we've covered the information, let's review the question. A 64-year-old obese male presents to the clinic due to worsening fatigue over the past several weeks. He states that he always feels tired despite sleeping 9 hours a night. His blood pressure is 172/98 millimeters of mercury. His current medications include lisinopril, amlodipine, and hydrochlorothiazide. What is the most likely diagnosis? A. Primary hypertension. B. Hypertensive urgency. C. Hypertensive emergency. Or D. Secondary hypertension. Okay, from the question stem, we learned that this patient is obese, has worsening fatigue, a blood pressure of 172/98, and is currently on 3 antihypertensive medications, lisinopril, amlodipine, and hydrochlorothiazide. Collectively, these clues should make us consider a diagnosis of obstructive sleep apnea. This is classically seen in obese patients and is associated with loud snoring and excessive daytime sleepiness. It is a known cause of secondary hypertension, which appears to be the case here because this patient is on 3 antihypertensive medications, but still has a blood pressure of 172/98. So the correct answer is D, secondary hypertension. Recall from this slide that patients with secondary hypertension have an underlying medical condition that is responsible for the elevated blood pressure, in this case, obstructive sleep apnea. A is wrong because his hypertension can be best explained by an underlying medical condition. B and C are wrong because this patient does not have a blood pressure of 180/120 or greater. So again, the correct answer is D, secondary hypertension. And that concludes this section.